Hello, this is Jane Coombs of workingwellsolutions.com, and this video gives an explanation of what occupational health is for managers and why you should be using it. As we all know, working in different industries can give health issues. Occupational health generally is able to advise managers regarding the consequence of working with different hazards and how to cut down health risks. Following on from the risk, if it's not controlled, there is the risk of civil, criminal or enforcement action, whereby injured parties can take the employer or organisation to court. Working with health issues can take up a lot of resources in terms of time if somebody's been injured. If staff do have health-related work issues, then many of them will not continue working and will leave your company. If a lot of staff leave because of ill health and litigation, then that results in poor publicity and low morale. If staff are affected by health, then that can affect your attendance levels, which in turn can affect customer service or increase pressure on the staff remaining. All companies have to have liability insurance, and if there is a lot of work-related health issues being reported, then that will affect your insurance premiums and they will rise. Overhead costs can be affected by high absence, poor customer service, and also trying to compensate for people who may be off sick. Work-related health issues are poorly understood by most managers and also by workers who can be scared by media stories. Occupational health can work with you and your staff to ensure that everything's understood about health and the real risks. Now, the work-related health issues will be dependent on the work or the sector that you're in. So, for example, low-risk work would be considered something like administrative or call centres, but high-risk work could be things like the nuclear industry, construction. There's also issues about health when you're dealing with certain products, such as the food industry, which can become contaminated. Depending on the work, there are upper limb disorders, and that could be people that use data inputting on display screen equipment and computers. The most common reason for absence in industry would be musculoskeletal disorders such as bad back, shoulders and neck. Work-related stress also is moving up the agenda and is the second most common reason for absence or work-related self-reported health issue. Ill health retirement, people that are retired due to ill health, which may be related to work. And then there are specific health issues like hearing, breathing, skin problems, where health surveillance programs are required by law if there are risks. So what does occupational health do best? Occupational health primarily is there to provide a health surveillance program to protect the workers against any work that they do which has a health risk. So they can test workers to make sure that the processes that they're undertaking hasn't affect their long-term health, and they do this by different types of health checks. So for example, if they were working with, say, a dust or a fume that could affect their lungs, then they can do lung function testing to ensure that there's no changes. If they're working in a high noise hazard area that is defined by the Control of Noise at Work regulations, then they can do hearing tests to make sure that their hearing is not affected. Occupational health can also help you with your health risk assessment when you get new starters in a job, because the new starters may not understand what the job's involved. So the new starter may not understand the job that they're coming into. So it's important that pre-placement health checks are done. Management referrals, these are appointments which a manager sets up for somebody to go along to occupational health if there is a health issue. And this can range from things like short-term absence, long-term absence, performance measures linked to health, or maybe just an assessment to see if there's anything a manager can do to assist the employee at work. Health promotion initiatives are very much on the government agenda, so they're looking at workplaces to make sure that there are opportunities for employers to give health instruction or education to their workers Occupational health can also give advice to management about what would be useful to provide for the staff, such as physiotherapy or counselling, or maybe there's other initiatives if there's a particular issue in your workplace. And then there are specific health programs and protection for your type of industry. So for example, food handlers, when they've been on holiday, they need to come back and ensure that they haven't picked up any health issues. Crane operators, these are safety critical workers, or healthcare workers, these would need to be vaccinated against various bloodborne diseases. So occupational health does this best. If you wanted a general explanation of what occupational health can do, it's really about understanding health, understanding individuals and their capabilities, and understanding your particular industry. They can interpret medical information and translate that into a form that you can understand, so that it's not like jargon or gobbledygook, but they'll give you a practical way of going forward as a recommendation. Occupational health professionals have been trained in the National Health Service. They understand how it works, and they can talk to other professionals to ensure that your individuals get fast-track referrals. And that doesn't mean jumping in front of others. It merely means that they know the route to go to get the proper treatment and the best way to do that, and to give the individual confidence to go forward to make sure that they're being dealt with promptly. Occupational health can also do workplace assessments, and what this means is really about ergonomic assessments. So it could be that somebody has a bad back or a bad neck, an upper limb disorder, and they are saying that it's caused by the work they do. So occupational health will go out to the workplace, looking at the job with the individual and seeing if there is any ways of improving that and to prevent the injury from happening. Occupational health can also help you comply with the law. There's lots of health laws. For example, the control of substances hazardous to health, so they can help you with your COSH risk assessments and with manual handling risk assessment, noise risk assessments, pregnancy, stress. All of these, occupational health has the know-how to be able to give you real professional advice about how to do this on a grand scale. Recently, it's been shown that early return to work is very beneficial for both the individual and the organisation. This can help reduce costs for a manager or a business owner, and occupational health can help individuals return to work safely and by not compromising their health at all. If occupational health are undertaking all of this work, that frees up management time to concentrate on other areas. I also referred to the fast-track referrals and how occupational health professionals understand the healthcare system, and this will give you real benefits when you are dealing with GPs and fit notes, and how to ensure that you get the best for your employees. In fact, employees will benefit from talking to occupational health if they have any queries, because they often don't want to take up time with their own GPs. And certainly, if you have occupational health, then it is seen as an added benefit for staff. So an OHA and OHP, an occupational health advisor, is generally a nurse who has extra qualifications in occupational medicine, and the occupational health physician or the doctor. These are recognised as impartial and independent, so they won't be looking at things from the employer's point of view or from the employees, but looking at the situation and the medical information and the work, and making sure that any recommendations that they give back to you and to the individual is impartial and independent. All occupational health doctors and nurses, that's OHAs and OHPs, all doctors and nurses work to professional guidelines to ensure that they remain doctors and nurses, so there's ethical standards which we have to abide by. The occupational health advisors and doctors will negotiate a way back to work or to improve attendance the best way possible for everybody. So they're trying to negotiate a way back that suits everyone. And what they will do is tell the employer straight what the implications are and will tell the employee straight what the implications are. And then they will come up with some type of rehabilitation program if required, which could include change of shifts or changes to their job role. They will then put this back to the employer to make a decision about whether this sits well with the work requirements. Occupational health have to understand basic employment law, such as the Equality Act and fairness in the workplace. We are also regarded as a competent person by the Health and Safety Executive. And occupational health professionals, and this is a really important point actually, advise management. They do not make employment decisions. So after the conclusion of talking to an individual and examination, the occupational health professional will write a report back to management, advising recommendations which are impartial and independent, but then it's up to the employer or the manager to decide whether to take that recommendation or not. Absence is very much on the agenda as well with the government. The top reasons for work-related absence is musculoskeletal problems, which I've already mentioned, and stress. Occupational health can work with managers to put together a policy to be applied across the company. And occupational health can help with that in setting out a fair and equitable policy. For absence, there are aids for dealing with this, things like the Bradford Index or targets for attendance, training for managers. But I think it's important to say that if you have a high level of absence in your company, then occupational health can advise you on how to best control it, provide training, and also see employees to look at the causes and see if there's any way of improving attendance. Also, it's important to communicate with those off work, text messaging or telephone. Again, it will depend on your policy. Leadership is also important with absence to make sure that you treat everybody the same and you follow through with return to work interviews. So the best way to get a good result from working with occupational health is firstly communication, and managers need to communicate very clearly to occupational health what they need and what they expect. So this will be in the form of reports, management referrals, case conferences, discussions, key performance indicators of when you want the results back, monthly reports of how the service is going. Occupational health works best in a team working situation. So working with the manager, with the individual, with the trade unions or the workers' representatives, firstly to set the policy and then to engage and provide a joined up system of assessing an individual or the workplace to protect health at work and to protect the individual. It's about collaboration, negotiation, and sometimes compromise. But above all, there is the need to trust occupational health, and for occupational health to trust management, and for the employee to trust both. So that's really what a manager can expect from having occupational health. What I've got here is a list of resources where you can go to for further advice. If you are a small business, there are helplines, free helplines in England, Scotland and Wales. If you're thinking of choosing an occupational health service, then you can go to CQOS, which is a list of accredited occupational health services that guarantee they've been checked by the Faculty of Occupational Medicine. There's also guidance from the Faculty of Occupational Medicine about how to choose an occupational health doctor. And if you're researching any particular health conditions and want more, please go to a reputable source, and I would suggest the NHS Choices web pages that I've put there. There's lots of laws that affect health in the workplace, and I've mentioned a couple of them in this presentation. I hope you've enjoyed this presentation. If you have any more questions, do drop me a line at jane.coombs@workingwellsolutions.com or go to my website if you need some free templates and questionnaires. There's also more videos on health-related work issues. Please sign up for my monthly newsletter if you want information about what's happening in the world of health and safety. So thank you for listening. I hope you've enjoyed it.